I have to tell you that there's so many days now that are marked around the world. Sometimes you get baffled, you get confused sometimes. And now being marked this year is World Voice Day. Just think about it. Just ask anybody around you whether they know that their voice is a good organ that they need to protect. Now, we have apparently the University of Ghana training language therapists. They're supposed to help you and I if we develop some problems with our voice, especially as a broadcaster, to get to know how well I need to treat my voice. More so, if I have some abnormality or some difficulties with voicing out notes, etc., in the course of my work, or maybe because I've gotten sick, and so that's an effect, I will be in a position to be given some diagnosis and also some treatment. Look, I'm making entry to one of the wards. It's the South Ward, Room 10. And it's where we have the first batch of some of our practitioners, the therapists, the language and voice therapists. I would want to ask them whether even some of the phrases I'm saying is right. And this is a typical setting. So you're having a typical setting of a patient getting a consultation from a language therapist. And this is how it goes. I would want to get what the conversation will all be about. We'll have some great demonstration of what it should be. And then we'll also try and get onto the trail and get to know what really is happening. I know you're Abna.
Yes, please.
Abna what?
Also in tree.
Okay, Abna. And then you are?
Godwin.
Godwin.
Yeah.
And you're posing as a client?
Yes, as a client.
Okay. And we know that you're the first batch to be trained by the University of Ghana. We'll talk about that. But let's see the simulation that you want to play here.
You have a referral from the ENT, which states you have a diagnosis of vocal noodles. And in other words, it's also known as singer's noodles. Do you understand what it means?
No.
Okay, so vocal noodles is often as a result of overuse of the voice.
Okay.
And because of this, it means that the vocal folds, I can say they are two elastic bands. They act more quickly because, and it's an overuse because of the way you sing or of the way you talk. So can you tell me your profession?
I'm a teacher.
You're a teacher?
Yes.
And what other things do you do?
I sing in church as well.
Oh, so that's what has resulted in you having a singer's noodles.
Okay.
So what I'm going to do is I'm going to take an assessment of your voice, and then I'll tell you what we can do to help you manage your voice.
Okay.
So does your voice sound dry and raspy and hoarse?
Yes.
So do you use a great deal of effort when you are trying to talk?
When I'm trying to sing, yes, but talking, no.
Okay. So do you run out of air when talking?
Yes.
So do you often have to shout for others to hear you?
Yes.
Okay. Do you have to repeat yourself when you are talking face to face to someone?
In crowded areas, yes, I have to shout.
Okay. So tell me the truth. Do you feel you drink plenty of water?
Not really.
How many glasses do you think you take in a day?
Well, about 2 sachets, I'm okay with that.
It's too bad. Do you smoke?
No.
So do you constantly clear your throat?
Yes.
Do you talk for long hours during the day?
Yes.
Do you work in a dry or dusty atmosphere?
Because of the chalk, I would say yes. I write on the board more often with the chalk, so yes.
So where you live, is it a dusty atmosphere?
Yes. The road is very dusty.
So when you do eat, do you think you do have reflux? Do you think the food comes back up to your throat?
Yes. And when it comes, it makes me want to clear my throat more often.
So I'm going to...
So the diagnosis is ongoing. And usually they have a number of questions they have to ask. Let me typically also try to take what the samples will be. For example, they'll keep asking you your profession, your marital status, and this is a voice screening form, I should say. If you have a number of children, they would also want to ask, for example, they would want to know whether your voice sounds dry, raspy. If you know what a raspy voice is, I don't know. or horse. I think I know what that was. And so they have all these indications for you and I, if let's say I was a patient, for example, sometimes, never or always. Now, voice therapy has become very important these days, and that's why the world marks World Voice Day. But to have professionals, not only trained by the University of Ghana, but also Ghanaians, who would be practicing their trade for the first time as pioneers, is something that we have to take cognizance of. You know, we've had some of the big celebrities we have in Ghana who have had problems with their voice. They needed to go for some coaching or some medical treatment, etc. Let me first ask Abna, why she has to go through all these questions with a typical client?
So there are lots of factors which come into place which affects people's voice. And some of the questions I asked are some of the things that result in people having voice problems. So I had to ask him if he knew he had a hoarse voice, if he stayed in a dusty environment, or if he had reflux, because all these are contributing factors which affect our voice on a daily basis and which we know nothing about.
It's always a worry when somebody develops a voice problem, maybe either as a young person or later in life. But do we have typical statistics as to the number of cases that may have been recorded? Do we have facilities that would do treatments even at all?
For the typical statistics, I'm not very sure of. But the facilities that help, we do have speech and language therapists at the moment in Ghana who are trained to help people who present with these voice problems. And we can find them at Kolebu Teaching Hospital, Ridge Hospital, Cape Coast Hospital, Koforidua Hospital. Yes.
Well, let me go on to the one who posed as a patient. He actually is also a speech and voice therapist or language therapist. Okay, I need to get the language right. But if you can just stand for me, it will help also. I think I'm now being a therapist with the way you sit. But look, typically, why should I care about my voice?
Okay, so vocal care is something very important for us because it's the quality of life. It is our life. Imagine you talking to me right now and I'm unable to speak to you, or I'm speaking in a manner that is so creaky, raspy, bready, and you go like, what's this guy saying? I can't really understand you. And so that's very important. It's very important for us to take care of it, for us to work with it. Especially those who use their voices a lot, they have to take care of it because that is their life. Without it, if you lose it, there is no way you can go back to work. When the larynx, the vocal folds are taken out, you have to use artificial, and that you may not go back to work, especially if you are a heavy voice user. And so we need to take care of our voice at any point in time.
He has a couple of colleagues, and I would want also to get some interaction with them. I have Jifa here, and Jifa also trained with the University of Ghana. She's actually one of 12 pioneers of speech and therapy studies, I'm sure. I don't know. Okay, speech and language. Now, you started the course when?
In 2016.
2016, you started the course.
Yes.
Now, if you take a look at it, what should interest a typical person to want to study? Is it speech and language therapy?
Yes.
Why should I study?
We have a lot of children who have communication difficulties, and there are other people too. After stroke, they lose their voices. So it is very important for us to protect the voice, or to make sure we have quality voice. So that's why it's very important for us to be involved in this new program that is coming out in Ghana.
Okay. And I know that for a typical day, I tend to use my voice a lot. It also gives me the indication that, well, I may grow tired over the period consistently reading. But we also know that reading is now being encouraged in many schools. I have Letitia. You're Letitia. At least I remember your name now. Stuck. But do children usually also get affected by speech and voice problems? Because I know that they are young, at least their vocal cords will be stronger than the average adult.
Yes, the interesting thing is laryngeal papillomatosis.
What's that?
It's a condition that comes about as a result of sexual contact, and then a mother can also pass it on to the child during birth. And this is now creeping up, and children, before they are born, they already have that condition, and it makes it very difficult for them to, babble, express themselves, and do all sorts of things. So yes, children are also getting voice disorders these days. When they go to school, they are screaming, shouting, and all that. So it has an impact on their voice as well.
That is serious. Now, I'm thinking, because I have two sons, and I'm thinking typically because of how bubbly they are, and sometimes they may develop some of these things. So how aware should a parent be? What should be some of the signs that you need to pick up to know that maybe the difficulty with your child's voice is actually something that needs treatment?
Okay. I believe you know your child and their day-to-day interaction as they keep screaming about going about their duties. I think the best thing to do is to watch how they behave, because sometimes it comes with pain. It comes with pain, ear pain. It comes with swallowing difficulties as well. So as speech and language therapists, we also look to swallowing. So you should look out for some of these signs from your children. If they are eating and they are choking, their eyes are all red, they are coughing, these should tell you that your child might be developing a voice disorder.
I'm thinking, I have difficulty with the ear, or a child has a difficulty with the ear, some pain is reported, maybe around the neck or the throat area, you're having some pains, and all that should get me worried as a parent.
Yes, it should get you worried. It is believed that when you have a voice problem, if after 2 weeks it's still persistent, you quickly have to see your doctor, a general practitioner, who might recommend you to an ENT if it's in a severe state. So it's advisable that you keep a track of that.
What's severity? Severity means what? Who judge severity?
When an individual is unable to use the voice for the daily activities, that is where you know it's severe, because you're not able to communicate with your people, you're not able to, do your daily activities and all that.
Well, we have to get one or two other interactions. Let me carry my chair. It's a bit difficult these days getting to sit down. So now, I didn't ask your name the first time.
Godwin.
Now, Godwin, if we have to look at a typical Ghanaian who would go through JAMA in school, maybe have gone through a typical JAMA couple of sessions, but we tend to lose our voice once in a while doing that, or very often. Now, if you lose your voice once in a while, or you lose it often, are any of those danger signs?
Yes, so if you lose it often, they are danger signs. That is why you need to see a general practitioner or your medical doctor for a referral for diagnosis of what is happening. So you see that and you are able to know that, okay, what is happening, it's me having a voice problem, raspiness or breathiness. So the JAMA and all those things are some of the signs. When you lose the voice after that more often, there are signs that no, you need to lubricate your vocal folds often. And how you do that is by taking enough water. You sip it more often when you know you are someone who leads this JAMA kind of, or you are someone who does this kind of activities. So you need to lubricate it by sipping enough water. So if you listen carefully, the therapist was asking me how many glasses of water I drink in a day. So that is a way to let me know that my vocal folds are not lubricated. That's why I'm having the problem. So the water will lubricate it, and as and when I talk that much, it will not be tired. It will be clear as it's supposed to be. So for JAMA and all that, yes, it's a sign.
Lubricate, eh?
Yes.
Lubricate. I didn't know that we have to be lubricating our throats, But look, water. Ensure the ensure. But these days we have a lot. Now we have fruit juices. We have a lot of liquids around. Is the best advice always taking taking water to keep it moist, to keep your throat moist, to keep it, as you use his word, lubricated?
So
You can drink some fruit juice.
okay, we suggest water because, you know, with water there are no preservatives, there are no chemicals, and we are sure that with water it keeps you hydrated and it keeps your vocal folds lubricated. But let's say with alcohol, we wouldn't really suggest alcohol because it dries up the vocal folds.
Really?
Yes, and it sometimes swells it, so it might not be able to function as it's supposed to. And with the fruit juices, we are not saying no one should take in fruit juices. It's a good thing, but we would really prefer you taking more water than to take in more fruit.
It's the best, you say?
The best.
But we're now having a vibrant music industry. And it would also mean that we have a lot of the Miss V, we have a lot of the Fears, we have a lot of the male singers, Sarkodie even raps and all that. I think that's where they need professionals like you. Is that because, I mean, it's not a popular therapeutic activity, but how often should they be seeing a therapist?
I believe as often as they can because they are at a higher risk. Aside from the fact that they sing on a day-to-day basis, they are going to talk. So the fault is working more than it's supposed to, yes. And aside from the fact that they do sing, they do a lot of screaming just to get the fans to be on their side. And it's also causing trauma to their folds. But they are really not aware of that. So that's what basically we do with them.
And I keep hearing, you know, when you go to church, the pastors you scream. Are they also prone? And shouldn't they be having a typical voice therapist around them? Because, you know, when you go to Hollywood, you get to hear that Celine Dion has lost a voice as a therapist, you know.
It's very, very necessary for pastors because they have the microphones, yet you hear them screaming on top of their voices and everything. So it's very necessary for pastors to come on board and then screen their voices because they are constantly using them.
Should we come to a point where maybe those who tend to use their voice a lot now need to have these therapists on their, maybe their bills? They'll be paying them some retainers every month. I mean, not that they work for you, but at least.
I believe the best thing is to see a speech and language therapist, and then you are assessed by the speech and language therapist. So if anything, we refer you to the ENT specialist for their advice. So they give us the diagnosis of what you have. Then we work with it. But in the meantime, what we do is we'll give you maybe like vocal hygiene tips for you to go by. Drinking water, avoid screaming and shouting and yelling, and all those things that will cause trauma to your voice. Yes.
Okay. Look, I have to end the conversation. I've been doing this for some time. Let me just speak to Jifa. And Jifa, that's all. Now, Jifa, what's your aspiration? Why did you decide to study speech and language therapy?
Wow. For me, I have a cerebral palsy child. So we had a difficulty getting someone to help us with the speech aspect. So when my husband saw this program, then he advised me to enroll in the program so that I'll help alum and then other children or people who they are experiencing difficulty with the language or other aspects of communication. So that's why I joined the program.
All right. How long did it take you?
2 years.
Just 2 years?
Yes.
It's not just, right? Yeah, and it's a master's program. But I'm ending with you, Godwin. Godwin.
Yeah, Godwin.
All right. Now, look, I know that there are a lot of people, children with abnormalities, those who are vulnerable and they will need this help. Maybe somebody has a stroke, maybe autism, etc. But we don't have these professionals as you are working in such fields. What would you say to them?
So the University of Ghana is doing so well now, training a lot of us into the system. And so what we want parents and caregivers out there to know is whenever they see any of these signs, they should try and speak to their doctors so that they would refer them to the speech and language therapist. We are there. They are at places you find them. When you want one, you go to Kolebu, you come to the Greater Accra Regional Hospital here at Ridge, and then you'll be sure to have a specialist attending to the communication needs of those children and any other person who needs it.
Are you expensive?
No, we are not.
Well, I think that I would advise anybody to make sure that they hook you up, and your services should be used as much as possible, because Ghana really needs you.
Especially the politicians. The season is coming now. Most of them will be screaming on campaign platforms. They should try and visit the speech and language therapist.
Actually, they need to carry you along on the campaign trail.
Yeah, they have to.
All right. Okay. So, but that'll be it for now. But it's World Voice Day. Just think about it. And so I've had, just turning my back, I have had again. Abna.
Letitia.
Fa. Godwin actually lives with me at Ajekweju, so well, that's good. He wasn't affected by the flood, so we were never really affected. But I don't know. Sometimes they get to find a good way by which is rudimentary, but your voice also gets to be trained. Speech and language therapy is needed. It's a profession that will take us places once we know that we have to use the right professionals if we have any abnormality at all to get it cured. World Voice Day. Just think about it. Your voice is your tool.